about the taste? Or with the Frosted Flakes, what about the texture? Or with both of them, what about the texture? What about the experience of eating cereal? Whether it's hot oatmeal versus grits, or whether it's Kellogg's Frosted Flakes versus Multimeal. How many of you have had Kellogg's Frosted Flakes? Okay. How many of you have had Multimeal Frosted Flakes? All right, those of you who have had Multimeal Frosted Flakes, are they the same thing as Kellogg's Frosted Flakes? Are they much worse than Kellogg's Frosted Flakes? Not much worse? I think they are. I'll let you have your opinion. It's a complete, it's a different experience. Kellogg's Frosted Flakes they do sugar differently, they use different technology. So if you are going into a meal and you're getting Frosted Flakes and you're thinking, I'm going to get some Kellogg's Frosted Flakes, and somebody puts Multimeal Frosted Flakes in front of you, you might be a little disappointed. Now, and that's fine with cereal. But imagine if the difference is between a generic drug and a brand name drug, where they both do basically the same thing. They have the same active compound. But the generic drug has some side effects for you that you don't like. Your insurance company is going to tell you buy the generic drug, because that's $4 at Walmart. And the other drug is $100. Well, those side effects are a little bit more serious than the side effect of the fact that you're going to eat big chunks of oats instead of little grits. And you should be able to make that decision about whether that extra $96 or better, or to keep you as healthy as you can be while you're dealing with your medical problem, is worthwhile. Why would you trust a panel of experts to tell you what's healthy for you? Would you trust a panel of experts to tell you that you have to eat oatmeal in the morning instead of grits? Would you trust a panel of experts to tell you that Multimeal is the exact same thing? Or would you trust this guy here who said that Multimeal is about the same? Would you trust him with your breakfast cereal, the most important meal of the day? Okay, don't be in your mouth. You can skip breakfast if you want to. But really, the goals of health reform are pretty straightforward. And they're the same goals that everybody talks about, whether it's the president, or whether it's the head of the Republican Party, whether it's the people who say healthcare is a right, or whether it's the people who say healthcare is a privilege. They all say we want to guarantee the same things. We want to guarantee access. People should have access to care. We should have a low cost, or at least keep the costs in check. And we should have high quality. Now, a lot of people will tell you that you can only get 2 of 3. You can have guaranteed access for everybody. You can have high quality care where you get your choice of doctor, but then you're not going to be able to rein in costs. Or you can keep costs low, and you can guarantee choice of doctor, but you're not going to be able to have the same access to the same quality. It's what we see in Canada and what we see in England. They're wrong. You can have greater access, lower cost, higher quality. You can't have greater access to everything, but you can have greater access. And there's one way that we've already seen works. We've already seen it in cars. We've already seen it in computers, in televisions, in water, in many areas. You decide for yourself. You get to pick what you want. And when you do that, that's not somebody rationing your care. I mean, it's a scarce good, right? So there is going to have to be some kind of rationing, but it's you deciding, you making the decision. And you can find a way to improve access. We can find a way to get better quality. We can find all of these things if the consumer's in charge. And we've seen it not only in all of those things outside of healthcare, but we've seen it within healthcare as well. You see it with dentists. You see it with LASIK eye surgery. You see it with plastic surgery. All of these things are generally not covered by insurance. Very few people have dental and vision insurance, at least not for their whole family. Sometimes the employers will provide it, but a lot of times it's not there. So people are making decisions about who do I see for my dentistry. And it's very clear when it comes to care who is in a market and who isn't. How many of you have received either at your home or here on campus or someplace something saying, come visit us at the dentist at the dentist's office. Visit our office and we'll give you a discount on your first cleaning. Anybody see one of those? How many of you have seen in the Sunday papers coupons off eyeglasses and eye exams? Yeah, a lot more people. How many of you have seen a coupon for a doctor for your medical exam? Yeah, I didn't think. Doctors don't have to compete for your dollar. They go to the insurance company. You're in the network. You're in the same network together. If you switch insurance companies, you have to find a new doctor because your old doctor isn't in the network anymore. They don't have to compete. They just sign up, they take the contract, and then they complain about the fact that the insurance company doesn't pay them enough and they have to go through all of these hoops. Sorry, doctors can't have it all. They have to make a decision about whether they want to go through hoops or whether they want to get paid. And really, it comes down to who paid. Taking a look at it on again. When I put this presentation together, it was not that I was hungry. It just worked out that I did a lot of food analogy. When you pay for food and you eat your food, I don't know about you, but I think Bojangles is a good bet. Okay, you can disagree. That's the beauty of it. You can disagree. But if I'm paying and you're eating, I'm giving you a peanut butter jelly sandwich. Sorry, that's all you're getting. But if somebody else is paying, and I'm making a decision for everybody in this room, if somebody else is paying for your dinner, and I'm in charge of it, everybody's getting Chick-fil-A. Because pretty much everybody can agree on Chick-fil-A. I know the vegetarians can't. But that's part of the problem with having me be the decider for you. It's part of the problem with having your insurance company decide for you or the government. They're going to pick something that you're going to think is just awful. Now, if somebody else is paying, and I'm eating, I'm going to Ruth's Chris. I'm getting one of these steaks. And that's the other problem with having somebody else pay the bill for our health care. The doctor says to you, well, you need a CT scan. You never think, because you got hit in the head. You never think, well, doc, how much does that CT scan cost? And how much is it really going to show? It's like $1,000 or something like that to run the CT machine. See, I don't even know, because I've never had to ask the question when they offered me that. And I said, well, and you say, well, what's the benefit of it? Well, you could have a little bone chip floating around in your skull from falling. Oh, that would be bad. Bone chip in my brain. Sure, go ahead, do the $1,000 test on me. The whole time you're thinking, there's no way that fall did that to my head to cause a bone chip to be floating around in my brain. But might as well eat it. Might as well go to Ruth's Chris and get a good steak. So that's how we solve the problem. Is we allow you to be in charge. We allow the consumer to be in charge. And the proposal so far, whether it's the Baucus bill or the House bill or the President's plan of platitudes, he doesn't really have a plan. You don't have to take my word for it. You can go to the Kaiser Family Foundation. They have a side-by-side comparison of all 8 or 9 proposals that are out there. And under the President, in most places it says not specified. He doesn't have a plan. And that was actually one of the criticisms of those of us who didn't like what he was talking about during the summer. We would point to the House bill and we'd say, well, this is in there. And they'd say, well, no, that's not what I want. The President said that's not what he's going to go for. So the House bill, and we saw in his address to Congress last week or 2 weeks ago that really, no, he doesn't like the House bill either. I'm not sure that he likes the Baucus bill. Nobody apparently likes the Baucus bill. But none of the proposals that are out there so far provide any more ability to you, the patient, to you, the consumer of healthcare,